Dental hygiene instruments have a lifespan, and recognizing when they are beyond repair is critical to maintaining clinical excellence and ensuring patient safety. This session will guide you through identifying key indicators of irreparable instrument wear, understanding the risks of using compromised tools, and making informed decisions about instrument retirement and replacement. Protect your practice, your patients, and yourself by knowing when it's time to say goodbye. I've created several resources to support your instrument maintenance journey, which I'll be sharing throughout this presentation. You can access them via the link or QR code provided. I encourage you to download and print these resources to post in your practice as helpful reminders and to share with your team. Let's work together to elevate awareness and ensure everyone is on board with maintaining our instruments effectively. In this session, we are going to identify the physical signs that indicate dental hygiene instruments are no longer repairable or safe for clinical use. Understand the risks of continuing to use worn out instruments, including compromised patient care and increased clinician fatigue. Develop a protocol for assessing, replacing, and retiring instruments to maintain consistent quality and efficiency in your practice. So I often get asked, how often should we be replacing our instruments? That's a tough question to answer. The retirement frequency of dental hygiene instruments depends on several factors, including the quality of the instruments, the frequency of use, the types of patients that you see and treat, and maintenance practices. However, here are some general guidelines to help determine when instruments should be retired. Instruments used daily or under heavy workloads may need to be retired every 6 to 12 months, depending on wear. In high traffic practices, instruments wear out faster, especially if kits or cassettes are used more than once during the day. For example, do you have enough kits to get you through the day? One kit per patient. Regularly sharpening extends the lifespan of instruments, but over sharpening can cause excessive thinning and compromise their integrity. Instruments should be retired when sharpening no longer restores the cutting edge or when significant metal loss occurs. High quality instruments made from durable stainless steel or advanced alloys are designed to last longer with proper care. However, they still have a finite lifespan and require maintenance. Always follow the manufacturer's instructions for use, for instrument care, and lifespan to prevent premature wear and ensure optimal performance. Here are the physical signs that indicate dental hygiene instruments are beyond repair or no longer safe for clinical use. Blade thinning. The cutting edge or blade has become excessively thin due to repeated sharpening, compromising its strength and integrity. Or shortening length. The instrument no longer meets its original specifications due to significant material loss. A shortened blade reduces effectiveness and proper function. This is an image here that illustrates brand new instruments on the left. In the middle, these ones have the wear at about 20% wear, and the ones on the right are with 50% wear. While there may not be formal studies defining exact thresholds, clinical experience and expert consensus indicate that as instruments wear, their safety, functionality, and precision are compromised. At 20% wear, performance begins to decline, impacting efficiency and accuracy. By 50% wear, the instruments are too far gone to maintain its original design, making it ineffective and potentially unsafe. Instrument tip damage is one of the most critical concerns when it comes to functional safety. A broken or fractured tip is a serious safety hazard, not only for the clinician, but especially for the patient. If a tip fractures during treatment, retrieval can be challenging. Blunted or rounded tips are another major issue. Instruments that rely on fine tips for precision, access, and effective scaling lose their efficiency when excessively worn or dulled. A once sharp curette can become what I like to call a sickleized curette, losing its functional purpose and making it much harder to adapt to the tooth surface properly. Recognizing tip damage early is crucial. If you see signs of excessive wear, chipping, or rounding, it's time to retire and replace the instrument before it becomes a risk to both the patient and the clinician. Another key sign of wear is when an instrument shank or blade becomes bent or misshapen. Even a slight bend can impact the instrument's ability to adapt properly to the tooth surface, reducing precision and making it unsafe to use. Visible rust, pitting, or corrosion. Uh, these are all clear indicators that an instrument is no longer safe for clinical use. These issues compromise the structural integrity of the instrument, making it more prone to breakage during procedures. A weakened instrument not only affects performance, but also poses a serious risk to both the clinician and the patient. Loss of tactile sensitivity. This is essential for effective instrumentation. When an instrument is sharp and properly designed, it allows a clinician to detect calculus, root morphology, and surface irregularities with precision. However, as instruments wear down, they lose their critical feedback. Structural integrity is a key component of instrument safety. When an instrument develops cracks in the handle or damage to the shank, it compromises both functionality and safety. When you have repeated sharpening with no improvement, it's a clear indicator that that instrument has reached the end of its functional lifespan. And following the manufacturer's instruction for use and their specific guidelines for the lifespan of their instruments. By recognizing these signs early, you can prevent risks to patient safety, ensure clinical efficiency, and maintain high standards of care. Now, I'd like to talk about functional safety of instruments. Ensuring the functional safety of dental hygiene instruments is essential for both clinician performance and patient care. And instrument safety is defined by its ability to perform its intended function reliably and effectively without posing risk to the clinician or the patient. Instruments that are worn, bent, fractured, or excessively thin compromise not only their efficiency, but also patient safety. So the dangers of overusing instruments that should be retired: high risk of instrument breakage, ineffective and inefficient treatment, physical strain on the clinician, and a negative patient experience. Which leads me now to developing a protocol for assessing and retiring instruments. So we want to use magnification loops for regular inspection. This really allows clinicians to closely inspect for dull edges, fractures, and worn tips. And lighting tools, good illumination helps detect imperfections, thinning, or corrosion. Keep a master set of instruments as a reference. Maintaining a master set of instruments that remain untouched and unused serve as a valuable reference for your clinical practice. This set acts as a visual and tactile benchmark, helping you identify when instruments have worn down, lost their shape, or need to be replaced. I wanted to add about the Explorer because I see this as a major concern throughout, that so many people, so many dental hygienists, dental practices overuse the Explorers beyond. You can really only use the first 1 to 2 millimeter, and then it's no longer effective. And I just wanted to add this in here because with the Flex Explorer, it offers a beautiful thin wire, which increases tactile sensitivity. And I have an image here to show you the alloy rod that goes through from tip to tip for all of the instruments with LM, and this helps increase tactile sensitivity. All right, so when we are putting together a protocol, let's categorize our instruments. Let's color code them, color code the cassettes based on usage. So if they are relatively new, perhaps you're going to color code them green. If you start to notice that your wear is down 20%, perhaps you're going to flag them yellow. And then red is 50% or more. It's time to retire, and you flag those red, not for use. And there's several tools and methods to help track instrument wear effectively in a dental practice. This is one that I've created just in Excel. I will share with you, but you can create your own or you can use a software program similar to the LM's tracking system. So regular maintenance is key to preserving the functionality and longevity of your instruments. By establishing scheduled inspections, whether weekly or monthly, you can proactively assess wear and sharpness before instruments become ineffective or unsafe. And for the best rule of general rule of thumb, best practice would be assess, maintain, and retire. With proper care, most instruments have a lifespan. You could get 12, maybe 18 months in some practices. But if it's in high use, I would start to consider retiring them after every 6 to 12 months. It depends on what type of practice you are in. So by proactively evaluating and retiring instruments, you ensure optimal patient care, reduce clinician fatigue, and maintain efficiency in your practice. Now, if you're in a practice where they just will not buy you instruments, I always say invest in yourself and get your own. But before you have to do that, I would suggest that you set up a meeting with your team. You collect your information, all the things you need, where you're at with your practice. Do you have an instrumentation budget? Um, what are your patients experiencing? What are the dental hygienists experiencing? Present a plan. Again, show the pros and cons of what's happening in your practice now versus if you can implement an instrumentation program into your practice. Break down the costs, which I'll share with you. And this is the instrumentation proposal that I have this as a resource that I will share with you that you can work on. And there's things that you can do to perhaps shrink down a cassette. Perhaps you don't need so many instruments in every cassette. You could have a foundation cassette. Maybe you have 4 instruments per kit, and then perhaps you have a couple of perio kits, right? So there's ways. There's also, you can use instruments that have a dual purpose, like a dual Gracie, which is similar to a Gracie 1112 and a Gracie 1314 in one instrument that will scale down 2 instruments into one. So this is a decision tree that I created based on the classifications. So I'll share this with you. I won't get into it too much, but just think about your practice, what kind of patients you see, how many foundational kits do you need to get you through the day, and how many specialized kits do you need? And then you can work on your own on these worksheets here. All right, so in conclusion, when we look at the entire life cycle of an instrument, we understand the cradle to grave describes the complete journey of an instrument from the extraction of raw materials through manufacturing, clinical use, and finally to its disposal or recycling. And our goal is to extend the lifespan of our instruments for as long as we can. And we can achieve this by choosing high quality instruments, proper maintenance, and by maximizing the longevity, we not only ensure clinical efficiency, but also reduce environmental impact. Dental instruments are vital to delivering exceptional care, but they don't last forever. Worn, damaged, or compromised instruments hinder clinical precision, put patients and clinicians at risk, and reduce the quality of care we aim to provide. So as you leave here today, I encourage you to recognize the signs of when instruments are no longer repairable or safe. Prioritize functional safety by assessing instruments regularly and retiring them when needed. And advocate for quality tools and a systematic replacement plan to ensure consistency, efficiency, and safety in your practice. By retiring instruments before they become a problem, you protect your patients, your performance, and your long-term well-being as a clinician. Let's commit to treating our instruments as extensions of ourselves and never settle for tools that are beyond repair. Thank you so much for your time. today. And again, here is the QR code or the website you can visit to access all the resources that I will provide. And thank you so much for joining me, and I hope you enjoyed the session.